Good morning, everyone. So I actually had a few DMs on my Instagram asking about the process of physical therapy school. What is the process of getting in? What is it like? And how do you specialize in pediatrics? So getting into physical therapy school, you just need a bachelor's degree in basically anything. But if you know you want to get into PT before you start undergrad, I would definitely choose something like kinesiology or biology, because the prereqs to get into physical therapy school are things like anatomy, physiology, biology, chemistry. So if you're choosing a major where you have to take those classes anyway, it'll be way easier and cut a lot of time out. If you decide you wanted to be a PT after undergrad and you don't have a degree in one of those things, that's totally fine. You probably just have to go to a junior college and take those prereqs before you can apply. When you're applying, there is a website where you can apply to multiple schools at one time. If there is a school that you specifically want to get into, just check their website, look at their prereqs, because they can be slightly different school to school. Some schools have an interview process and some do not. Once you're in PT school, I won't lie to you, it is pretty rigorous. It is a full-time job. You're either in class or you're studying for a written test or you're working on hands-on skills. It is a lot of work, but a lot of fun. You will meet so many great people in PT school because you're basically with the same people in the same classes like all day long. So that's fun too. But some classes you're just sitting in the classroom and you're learning from PowerPoints, typical what you would think, in school. Others, you're working on hands-on skills, you're practicing basically treating patients. And then at my school specifically, so every school can be a little different, we had to have 3 clinical rotations, one in an outpatient clinic. So just a typical PT clinic that you would think of, people coming in with back pain, knee pain, things like that. You had to do an inpatient rotation, so in a hospital or a skilled nursing facility. And the third one was neuro. So pediatrics at my school counted for neuro, but you could also do like vestibular or a balance clinic or an inpatient rehab, just something where you're working with neurological patients. To get into pediatrics specifically, there's no extra schooling. You just would hopefully have had some on-site training at a clinical rotation, or if you want to shadow a therapist after school, if you didn't have the chance to have any pediatric rotation or a lot of pediatric education, but no extra schooling, just a lot of hands-on training.